This is total chaos in President William Ruto's government. Health Cabinet Secretary Dr. Deborah Longo was forced to abandon her press briefing after it was stormed by Kenyans. Let us see what took place.
It is not working. Please be aware, it is not working. Can you tell them what is happening? I am not going to talk. Let her talk and let this gentleman talk. And we have other patients waiting there at the gate if you are willing to come and join them. People have gone home. Others came from Kibwezi. Others have come from Mombasa. SHA is not working and they are not approving. From Wednesday last week, the systems are down. Please talk, madam.
Now that is exactly what I am talking about. I strongly feel that it is unfortunate for a Kenyan who is seeking health service to trek all the way from Kenyatta National Hospital to Afya House to storm a press briefing of a cabinet secretary who is in charge of the State Department of Health. It should not take place. What is the need of having a health cabinet secretary? It begs a question. What policies are the government putting in place to ensure that social health authority works? I have heard Governor Johnson Sakaja saying it is a good thing, it's a good program. But why do you feel that Kenyans are suffering in their own country, yet leaders are saying social health authority is a good thing? I want us to discuss what the government should be doing, because health is very important. But before you do that, in case this is your first time, kindly take a second, subscribe and turn on the notifications bell. We are on a mission to 6,000 subscribers before the end of this month, and we can't hit 6K without you subscribing. Thank you. I strongly feel the first thing the government should be doing is to identify the problem. Why is it that the Social Health Authority is not working in the Republic of Kenya, despite the fact the head of state is saying it is a good thing? What will happen to those patients who are in upcountry and they can't access Afya House? They cannot storm any press briefing by a cabinet secretary to understand that they are suffering. So they must identify the problem. And these people that are given the mandate to ensure the social health authority works, most of them should be accountable, because you cannot play with the health of the people of Kenya. There are people who are very sick. Do you expect them to trek all the way from all the hospitals in the Republic of Kenya to Afya House to storm a press briefing by a cabinet secretary so that they can be listened to by a cabinet secretary? It is very unfortunate. And number two, I think they should come up with solutions. If the system is not working, they must find a system that is working. If the people that are employed to ensure that social health authority works, if they're not working, they should be fired. That is the reality on the ground. If the money is not there, then the people who are supposed to ensure that the money is there, those people should be accountable. And it must be something that is very fast, because health is very important. I don't know what you think, ladies and gentlemen. You can let me know what you think in the comments section. Now, I promised at the end of my videos to carry out civic education. This is what you need to do. You need to register as a voter as soon as possible, because we have two types of elections. We have by-elections and general elections. So the beauty of being a registered voter is that you can participate in both. Number two, you need to demonetize politics as soon as possible. Have you ever wondered where politicians will get money after spending millions of money in a campaign, they might be tempted once elected to find a way of recovering their money. That is the reality of the ground. How will they do it? They will steal public funds, which is not good. Then lastly, you need to vote for someone with a vision, someone who can take your ward, constituency, and the county at large. Bye for now. I will see you in the next video.